Hi, I'm Dr. Kim Shepard with Align Family Wellness, and today we're going to be talking about ear infections. I have been seeing a lot of babies and kiddos with ear infections in the office for the past few weeks because of all of the weather changes and just season changes and people being sick. So I wanted to do a video on ear infections. I'm really passionate about ear infections because I was that kid. I was the kid with the ear infections. I had ear infections from when I was little. I had 2 sets of tubes put in. I had a hole in my eardrum that I had to have repaired. I was a kid of the 80s. I had countless antibiotics, and I promise you there is a better way, because as we know, all of those antibiotics, they cause gut issues, and I paid the price for all of that. And it was a really rough childhood for me because I battled so many ear infections, and I was constantly, having to put drops in my ear and doing all these things for the ear infections. And so I'm really passionate about giving you a better way, a natural, holistic way to help your kiddo when they have ear infections so that you don't have to go the route of antibiotics and tubes. So let's talk about what an actual ear infection is. So they're called acute otitis media, and that's because they occur in the middle ear. So we're talking, ear infections from kids being sick or viruses. So they occur in the middle ear, and they occur in the air-filled space behind the eardrum. That is most commonly where ear infections are located. So what causes ear infections? So there's 2 major things that causes them. One is poor plumbing. So poor plumbing in your kid's drainage system. So the eustachian tubes in children lay really horizontal, and they're pretty even with their drainage system. So it's just kind of lays like this. Adults, our eustachian tube lays at a slant. So it kind of goes with gravity and everything can drain well. Little babies and little kiddos, theirs just stays flat. So gravity does play a role in, that fluid moving and being stuck and being, in one place, but movement is what really is important. And so what happens is when we get tension in the upper neck, which is right underneath where those ears are in the eustachian tube, with either just birth trauma or, poor head position, leaning over all the time, basically we can get some restriction in the upper 2 vertebrae, and they share a lot of nerves with the inner ear and the sinuses. And so when they get stuck and they don't move really well, it clogs the drainage system. So that drainage system can't drain because everything is really tight up here. And so then we get structures of the ear, nose, and throat, and the lymphatics that get really blocked up. And so things aren't allowed to drain because everything is just stuck. That plumbing is clogged. And so that when we're sick, we get a lot of inflammation and we get a lot of swelling in our sinuses, and that can really help kind of plug up everything and not allow everything to drain. So that's when things start backing up. And then when things back up and they kind of lay there stagnant for a while, then we get true, ear infections. So that was number 1, the poor plumbing. Number 2 is a lowered immune system. So kids who are chronically sick with upper respiratory infections get a lot of ear infections. You see my dog? Sorry, he's hanging out. So most ear infections are secondary to a post-viral illness or some other kind of illness. That's usually what we see. They show up after they've had a cold, they've had a sinus issue, they've been coughing. That's when the ear infections show up. So they're usually secondary to a post-viral issue. So those are the 2 things that can cause kiddos to have ear infections. So let's talk about antibiotics. That's what is commonly prescribed when you go in. They look in your ears and they're like, oh, you have an ear infection. You need antibiotics. According to the American Academy of Pediatrics, 80 to 85% of ear infections are viral. Viruses do not respond to antibiotics. They are reserved for bacterial infections. So if you take 1 round of antibiotics, or your child takes 1 round, which is, let's say 5 to 10 days worth of antibiotics, usually 10 for an ear infection, it can take your gut microbiome up to 2 years to regenerate all of the healthy flora that it needs after just 1 round of antibiotics. Most of the kiddos that have come to see me are on 3, 4, 5, 6 rounds of antibiotics before they get to my office. Can you imagine how long that takes for their gut to heal after all of those antibiotics? So a lot of times with chronic antibiotic use, you can actually get a yeast overgrowth in the ears. So when they get chronic ear infections, they get antibiotics. Well, the antibiotics aren't taking care of the condition, so then they develop yeast from the antibiotics, so then they have yeast infections in their ears. And I have seen that in my office also, and that's just gnarly to treat too. So kiddos with antibiotics within the first 12 to 24 months of life have a higher chance of autoimmune and inflammatory issues later in their life, because it goes back to that gut microbiome. So we want to be able to treat kids without antibiotics. So the next thing they do is they tell you, well, let's put tubes in their ears. So a lot of times the guidelines for tubes are 3 ear infections in 6 months or 4 to 6 ear infections within 12 months is kind of the guidelines for kiddos to get tubes. Ear tubes are the second most common surgical procedure performed on kiddos after circumcision. So if you eliminate circumcision, they are the #1 surgical procedure that is performed. So hear me when I say this, and please understand this, parents. When you have tubes put in, it does not mean that your kid will not get ear infections. The tubes only act as a vessel for that fluid to drain. They are just an escape mechanism for that fluid. They do not prevent your kiddo from getting ear infections. 98% of kids with tubes will get another ear infection within 2 months, because we're not getting to the root cause. We're just giving them a better drainage system, but we still aren't preventing the ear infections from happening. So how can we prevent them? How can we help our kiddos not get ear infections and not have issues with, chronic ears and, all the plumbing being backed up? So basically, chiropractic care works on the 2 causes. We work on the poor plumbing system and we work on the lowered immune system. So when we treat the upper cervical spine, we remove the stress of what's blocking that plumbing system, and it allows everything to flow freely. We work on all the muscles and the joints in the upper neck behind the ears. And we also look for this stuck stress on our insight scans. So we're not guessing. We know which side we need to work on, which side is more affected, that needs more treatment. We can do some at-home care recommendations. We can give garlic drops. We also teach parents massage. We also do kind of a drainage mechanism in the kiddo's mouth when we teach the parents to do that. And we work on building their immune system. And so when we've got good drainage and we've got a good immune system and everything's working well, we can prevent some ear infections. So usually when a kiddo comes to me, we check their ears, we do a treatment, we follow up in 2 days, we do the same thing. We treat, check ears, and we do that for about 5 days. And sometimes some of that fluid lingers for a while, but usually by that 5th day, that's when we can say like, okay, we're on the mend and we don't need anybody else to look at this. And you can kind of have it self-limiting and the kiddo can get over it and everything's good. We really want to build their immune system. The vagus nerve lives in this upper neck area right around your first cervical vertebrae. If we can affect the vagus nerve, we can really, really help the immune process and keep your kiddo from getting sick later on. So most kiddos do great. The treatment is super quick and easy, and the kiddos like coming in and getting treatment, but we see kids from infants to teens that have ear infections, and we even treat a lot of adults with ear infections by just working on their upper cervical neck and releasing some of that and doing some sinus drainage. They really, really do well. So, it's 50 degrees in the middle of February right now in Illinois, and so we're going to have a lot of temperature swings. If your kiddo is suffering with ear infections or has had a history of chronic ear infections and you're looking for a different answer, give our office a call. If you know a mama who could benefit from this information, their kid has been struggling, please share this video. You can get a hold of us through Instagram, through Facebook, or call our office directly. And we would love to care for your little one. And we hope you found this video helpful. And stay tuned next time.